Tyco Healthcare is proud to present Tycare XL, a versatile and easy-to-use closed system for endotracheal suctioning. Tycare XL offers features that are more convenient to use for hospital staff and more comfortable for patients. A twist-open suction control valve with color coding for immediate recognition of the catheter size, a clear and resistant protective sleeve, an atraumatic dual-density suction catheter, an effective rinsing chamber, a rinsing port with one-way valve, an MDI port, and a rotating patient access valve. When getting ready to use Tycare XL, it is recommended to wear non-sterile gloves to avoid any risk of cross-contamination. The swivel patient connector on Tycare XL remains part of the breathing circuit for its 72-hour recommended time of use, whilst the suction catheter needs to be replaced after 48 hours. Labels in the package remind you when the system needs to be replaced. They can be positioned on the connector or on the suction valve. When using the product for the first time, it is important to set the vacuum level between -200 and -400 mm of mercury. Twist open the suction control valve with a 90-degree rotation, then press down and release. Make sure the patient access valve is in the closed position. This enables the complete isolation of the sleeved suction catheter for the patient's airways when suctioning is not required, thus maintaining ventilation pressures. Prior to the suctioning procedure, pre-oxygenation could be recommended for some patient groups, with the exception of neonates. You can connect Tycare XL to a tracheostomy or tracheal tube and then directly into the breathing circuit or the filter by means of the catheter mount. The double swivel patient connector is designed for patient comfort and reduced risk of torque. The port on the double swivel patient connector allows effective and quick drug delivery through the metered dose inhaler. To perform suctioning, gently insert the suction catheter down into the tracheal or tracheostomy tube after opening the patient access valve with an anti-clockwise rotation. The soft tip and the firmer proximal end of the catheter allow an easy insertion and manipulation through the sleeved catheter. Depth markings in centimeters help achieve correct placement. It is recommended to stop when you start feeling a light resistance. Apply vacuum during the inspiratory phase by pressing the suction valve intermittently while withdrawing the suction catheter until the black marking is clearly visible. To isolate the system or to clean the suction catheter, rotate the patient access valve clockwise. Vital parameters are not altered when suctioning is performed with Tycare XL closed suction system. It is recommended to clean the suction catheter after every use. This can be done using RespiFlow S saline vials or with a syringe half filled with saline solution. Connect the vial or syringe to the rinsing port and apply vacuum to inject the solution into the system. Since the rotating patient access valve completely isolates the patient's airways, rinsing can last as long as required. The unique design of the rinsing chamber enables a very effective cleaning of the catheter tip, thus resulting in the full removal of residual secretions which may have accumulated in the system. Once rinsing has been completed, twist close the suction valve, making sure the arrow is positioned at 90 degrees with respect to the suctioning flow direction. The suction valve is now locked in the closed position and the vacuum cannot be activated. Tycare XL is the only product which allows bronchoscopy or mucus sampling to be performed in a closed circuit. This is made possible simply by disconnecting the suction catheter from the patient access valve when in the closed position. Tycare XL package includes a set of sterile caps to protect the suction catheter and the patient valve. The self-sealing cap placed on the patient access valve allows the passage of a 6 mm bronchoscope, at the same time guaranteeing the maintenance of a closed system. Turn the patient access valve to the open position and introduce a bronchoscope through the self-sealing cap. When withdrawing the bronchoscope, hold the cap in place to avoid disconnection and ensure a perfect sealing. Once the system is completely isolated by turning the access valve to the closed position, it is possible to disconnect and dispose of the protective caps in complete safety. A locking mechanism allows reconnection of the suction catheter to the patient access valve, thus ensuring a completely closed system. Tycare XL closed suction system offers complete isolation of the patient airways with its rotating patient access valve and possibility of performing bronchoscopy in a closed circuit. Superior safety when using the system for both patients and hospital staff, resulting in a cost-effective step forward in the prevention of nosocomial infections. Tycare XL, the only closed suction system for total protection.